everyone and welcome to my channel. So today we are preparing for the medicine talks and we will prepare the important examinations which are the most common examinations in all the subjects and which are very important for especially the PED subject and the medicine subject. So the book from which I prepared the talks is Hassan book, and it contains all the important cases and examinations and the pictures and drugs and the x-rays which are important to learn for the talks of medicine. So we will discuss the medicine talks. I have made a PDF from this book. We will discuss that. Then we will discuss the important examination stations. And for examinations we are having 4 stations in the medicine talks. One is CVS examination, one is abdomen examination, one is CNS examination, and one is respiratory examination. So the most common command that is given in the CVS examination, that is the short case, is to palpate the precordium and the murmurs. In the abdomen, the most important questions that are the commands that are given is to percuss the spleen and hepatomegaly and splenomegaly. The most important common asked question in the CNS is to examine the motor system, and in the respiratory system is to examine the back of the patients and vesicular breathing and bronchial breathing. Okay, so these are the important examination stations. Then we have counseling stations. The counseling stations are usually from the dermatology and the psychiatry portion. So we should learn the dermatology and psychiatry units from the medicine book for this counseling stations especially. Then we have some drugs and we have to identify it, and we have to write the indications and contraindications and the uses. Then there are some photos of the important or common diseases. Let's suppose, for example, Down syndrome or etc. Then we have 2 scenarios that we have to write the answer of that, and then we have 2 x-rays. The most common x-rays that are present there is of cardiomegaly, pleural effusion, consolidation, and pneumothorax. Then we are having the ECG, in which we have to write about the atrial fibrillation. The 2 stations are of ECG, and the important ECGs are that of atrial fibrillation, atrial flutter, SVT, and MI. Okay, now in this PDF we are discussing the examinations. The most important examinations are of that of CVS, then the respiratory examination, then the abdominal examination, and then the CNS examination. In the CNS examination we will learn the cerebral examination and the cranial nerve examination. So starting from our first examination, that is the CVS examination. So we will discuss the general method and the important points from this PDF, and then in other videos we will perform the examinations physically. So in CVS examination, first of all we have to wash our hands, then introduce yourself, and then ask the patient his name and age, and then explain the procedure and gain the consent. So so this is the basic method for the examination. They first of all clean your hands, that is wash it or use the sanitizer. Then introduce yourself that I am Dr. Desh and I will be performing your examination. Then ask the patient name and his age, and then explain the procedure and gain the consent. Then first of all, expose the patient. The first step is to expose the patient. Then do the general inspection, that is, look around the bed if any oxygen mask is present or any catheters is present or any other substances that you can notice. For example, the cannulas or the IV drips or the catheters or the oxygen mask. So we will notice all these things on the general inspection. Then we will start from the inspection of the hands. First of all, inspect the hands. Look for the splinter hemorrhages. Splinter hemorrhages are present in the nails, and the disease in which splinter hemorrhages are present is infective endocarditis. So if splinter hemorrhages are present in the hand of a patient, it shows us that this patient is having infective endocarditis. Okay, look for the nail clubbing. Nail clubbing is present in congenital cyanotic heart diseases. Then if there is the loss of Chambrott's window in the nails, then it shows us that there is congenital cyanotic heart disease in the patient. Then look for the palms. In the palms, look for Janeway lesions. Janeway lesions are present in the infective endocarditis, and look for the oscillar nodes. Oscillar nodes are also present in the infective endocarditis. If you have no idea about infective endocarditis, then look for the CVS unit, the infective endocarditis and all its symptoms and the appearance on the physical examination is present in it. Okay, we will look for the capillary refill time. It is normal if it is less than 2 seconds. If it takes more than 2 seconds to refill, then it is abnormal. Okay, so up till now, what we have done in the CVS examination, first of all, we have the sanitize our hands and introduce ourselves and have taken the consent. Then we have exposed the patient. Then we have done the general inspection. Then we have done the hands inspection. On hands inspection, we have noted the specific things which are splinter hemorrhages, loss of the Shimrod's window, that is nail clubbing, and splinter hemorrhages, oscillar nodes and Janeway lesions, and then we have noted the capillary refill time. Now moving towards the next step, we have to look for the pulse. The pulse is first we will look it in the one hand, then we will look for it in both hands, which is known as radial delay. We will note the pulse and we will compare the pulse in both the hands, and this is known as radial delay. Then we will look for the pulse on brachial plexus, that is collapsing pulse. If it is present, if the collapsing pulse is present, then it gives us the finding of aortic regurgitation. Aortic regurgitation is due to the loss of diastolic distension of the large vessels as blood regurgitates from aorta into the left ventricle. Okay, so if the collapse of the pulse is present on the brachial plexus, then it gives us aortic regurgitation, which is due to the loss of diastolic distension of the large vessels as blood regurgitates from aorta into the left ventricle. Then we will look for the carotid pulse, which is to assess the volume and assess each side individually. Then we will measure the blood pressure. Then the patient at 45 degree and see for the GVP. Okay, remember this, that to find the GVP, you have to put the patient at the angle of 45 degree. Then if the GVP is raised, then it shows that there is right ventricular failure. Observe for visible GVP along the border of sternocleidomastoid. Then hepatojugular reflex is checked. Apply pressure on the liver and observe for rise in GVP. Positive result if sustained rise greater than or equal to 4 cm. Then corneal arcus or xanthelasma, that is conjunctival paleness, is seen. It is present in hypercholesteremia. The cause is stroke, coronary disease, and peripheral artery disease. Then angular stomitis is checked for iron deficiency anemia and central cyanosis, and which is hypoxemia. Then the close inspection of the chest is done. We will look for the scars in the midline sternotomy or infraclavicular lateral wall thoracotomy, and then the chest is inspected for pectus excavatum or pectus carnivatum. Okay, so what we have done after the inspection of the hands, we have find the pulse first in the one hand and then in both the hands, that is radial delay. Then the pulse on the brachial plexus is checked. If the pulse is collapsing, then the finding is aortic regurgitation, and the aortic regurgitation is due to the loss of diastolic distension of the large vessels as blood regurgitates from aorta into the left ventricle. Then we will find for the carotid pulse, that is assess the volume or character and assess each side individually. The carotid pulse should be assessed individually on both sides. Then we will measure the blood pressure. Then we will put the patient at 45 degree angle and we will look for the JVP. If the JVP is raised, then it shows the right ventricular failure. Observe for visible JVP along the border of sternocleidomastoid. Hepatojugular reflex is checked, that is Pressure is applied on the liver and then we will observe the JVB. If the result is positive, that is the strand rise is greater than equal to or greater than 4 centimeter, then it shows the ventricular failure and fluid overload leads to raised JVB. Then we will check for corneal arcus or xanthelasma or conjunctival pallor, that is which shows the hypercholesterolemia, and the causes of hypercholesterolemia are stroke, coronary diseases, peripheral artery diseases. Then we will look for the angular stomitis, which shows us iron deficiency anemia, central cyanosis, and hypoxemia. The close inspection of the chest is done, which shows the scars, and the chest is inspected for pectus excavatum or carinatum. Okay, after all these processes, the next step is to palpate the chest. Okay, so first of all, we will look for the apex beat. Apex beat is found at the fifth intercostal space and mid-clavicular line. For example, this is the clavicle and this is the mid-clavicular line and this is the fifth intercostal space. So at this portion, apex beat is fine. Not felt if thick chest wall and also disappear when patient is in shock or ventricular tachycardia. So the apex beat is usually not palpable in the thick patients, but if it disappears in the thin patient, then it shows us that the patient is in shock or the patient is in ventricular tachycardia. Then we will palpate the sternum angle, that is second rib present there, from that place count for the ribs. Okay. Then palpate thrills, that is palpable murmurs. We will look for the palpable murmurs. So for palpation, first of all, we will palpate on this position, that is 1, then 2, then 3. We will look for the abnormal murmurs if present, and the sternum angle is palpated on the second rib present there, from that place count for the ribs. Okay, after palpation of the chest, auscultation is done. While doing the auscultation, feel pulse in neck at the same time. You should put your 2 fingers on the neck and feel the pulse and also auscultate the patient. So for aortic valve, second intercostal space at the right sternum angle is palpated. Okay. For pulmonary valve, second intercostal space and left sternal edge is palpated. For tricuspid valve, fifth intercostal space and left sternal edge is palpated. For mitral valve, heartbeat at the apex is palpated. These are the positions. This is aortic valve. This is the right side of the chest and second intercostal space. So aortic valve is palpated here, aortic valve. Then the pulmonary valve, which is present on the second intercostal space and left sternal angle. Then the tricuspid valve, which is present on the fifth intercostal space and on the left sternal edge. Then the mitral valve, which is palpated at the apex beat. Then switch the bell and repeat all auscultation steps using the bell of the stethoscope. Okay, so first what we have discussed up till now, we have discussed the palpation of the chest. First of all, we will find the apex beat. For apex beat, the fifth intercostal space, that is the mid-clavicular line, is palpated, and if it is not felt, then the patient is in shock or in ventricular tachycardia. Then we will palpate the sternum angle, that is the second rib present there, from that place count the further ribs. Okay, then we will palpate the thrills on the 3 positions that is given in the diagram, that is on the right side, then the left side, and then on the apex beat side. Then we will auscultate the patient on the 4 different sides, that is the aortic valve, the pulmonary valve, the mitral valve, and the tricuspid valve. Then switch the bell and perform all the auscultations on the same positions while using the bell of the stethoscope. After auscultation, the next step is accentuation maneuver, in which we have to ask the patient to bend little on left side, and we can hold best in these positions. Ask the patient to take deep breath and then out and hold it like that. Ask the patient to take deep breath and then out and then hold it like that, so that the inside the body is free of air and you can palpate easily. So this is the accentuation maneuver, and this is for the mitral stenosis and the apex beat. In this maneuver, you have to ask the patient to bend little forward, little on the left side of the patient. Then auscultate the axilla to assess for the radiations of the murmurs. The accentuation maneuver 2 is to ask the patient to sit and then ask the patient to take deep breath and out and hold it, and at left sternal cage with diaphragm aortic regurgitation. For the accentuation maneuver 2 is performed for the accentuation for aortic regurgitation. The patient is asked to sit and take a deep breath, and then at left sternal cage with diaphragm, that place is palpated. If the aortic regurgitation is present, then the findings will be present there. After this, auscultate the carotids, that is murmurs, radiations or bruits on both sides of the neck. We have to auscultate that. Okay, the next step is auscultate the lung bases, that is for pulmonary edema. These are the sides. Then palpate for sacral edema, then assess for pedal edema, right heart failure, and then wash hands and cover the patient and say thank you. These are the places where these are the lung bases, and these are palpated for the edema. And for sacral edema, this place is palpated, and then for pedal edema, feet are palpated, and then at the end we have to wash our hands and cover the patient. After performing the examination, we will present our case like this. In summary, I saw 24-year male patient. What is the patient age and what is his name? We have to mention them. That in summary, I saw 24-year male patient. He was lying comfortably in bed. There were no signs of any cardiac diseases. On palpation of chest, you have to mention the specific thing. He was lying comfortably in bed. We have noticed this on inspection. Then there were no signs of any cardiac diseases. On palpation of chest, there were no heaves or thrills. On auscultation, there was normal first and second heart sound with no added sounds. This was a normal cardiovascular examination. For completeness, I will do the peripheral vascular examination, 12-lead ECG, fundoscopy, urine dipstick test, and bedside glucose test. Now, these are the important points which we should know while performing the cardiovascular examination. These are: the first heart sound is S1 sound, and it is due to the closure of mitral and tricuspid valve. Loud S1 means mitral stenosis is present. Hyperdynamic circulation, for example, anemia, pregnancy, or thyrotoxicosis. The loud S1 sound is present in the following conditions, that is mitral stenosis, hyperdynamic circulation, anemia, pregnancy, and thyrotoxicosis. Soft S1 heart sound is present in the heart failure and mitral regurgitation. Then we have a second heart sound, which is S2. It is due to the closure of aortic and pulmonary valve. It is normally splitting sound. Wide splitting sound, if it takes long in splitting, then there is abnormality, and the abnormality is due to pulmonary stenosis or right bundle branch block, and the fixed splitting is due to atrial septal defects. Okay, now in mitral stenosis, narrow mitral valves are present, and there is loud S1 and P2. Low pitch mid diastolic murmur at the apex is present. In mitral regurgitation, pansystolic murmur at the apex is present. In aortic stenosis, it is the most common defect of the heart, and crescendo-decrescendo ejaculation systolic murmur is present. In aortic regurg, early diastolic decrescendo murmur is present. Now, in mitral stenosis, we are having mid-diastolic murmur. In mitral rigors, we are having pansystolic murmur. In aortic stenosis, we have uh, uh, crescendo decrescendo systolic murmur, and in aortic regurgitation, we are having early diastolic murmur. So, this was the examination of the CVS. Let's revise what steps we have to do. First of all, expose the patient, then do the general inspection, then inspect the hands, then look for the pulse on the hand, on the brachial plexus, and on the carotid, then measure the blood pressure, then put the patient in that 45-degree angle and look for the JVP, then look for the hepatojugular reflex, then look for the corneal xanthelasma, then look for the angular stomatitis, and close inspection of the chest is done. Then we will come towards the palpation. For palpation, you have to palpate the apex beat and the sternum angle, and and palpate the thrills on the following position, that is on the right, on the left, and on the apex beat. Then we have to do the auscultation. Auscultation is done on the 4 different sites, which is aortic valve, pulmonary valve, tricuspid valve, and mitral valve. Then accentuation maneuver is performed, that is the patient is put in a left position, and accentuation maneuver 2 is performed, and then we have to auscultate the carotids. And after auscultation of the aortic valve, pulmonary valve, tricuspid valve, and mitral valve, perform all the auscultation steps, but on the bell of the stethoscope. Okay. After this, auscultate the base of the lungs, then auscultate for the sacral edema, then look for the pedal edema. Palpate for the sacral edema and palpate for the pedal edema. Then at the end, wash your hands and say thank you to the patients. Then you have to present your case. The important CVS points that you should know are that what is the first heart sound, what is the second heart sound, and in what cases it is loud and dull, and in what cases it is wide splitting. Then what happened in the mitral stenosis, the mitral rigors, the aortic stenosis, and the aortic rigors, and what are the important murmurs that are present in the following disorders. In the next section of this PDF, we will be discussing the respiratory system examination. Thank you.